Scenes of desperation inside a hospital in Italy. New York, now the epicenter of the coronavirus outbreak in America, is trying to avoid this. But New York is facing a shortage of ventilators like this, needed to keep sick patients breathing. Thousands more are needed. They don't exist.
We have about 5,000 or 6,000 secured. We need 30,000. Federal government has 12. I mean, this is a bad situation.
But it's not only a lack of medical equipment for patients, but also for those trying to help them. Doctors, nurses, and staff at hospitals just like this in New York City are on the front lines of the crisis. And many of these health professionals say they're lacking some of the most basic essentials to protect themselves, such as gloves and masks. Hospital staff taking to social media to call attention to the desperate situation. This emergency room doctor tweeting, "I'm lucky. I got the last pair of goggles in the ER for today. It's 9 a.m. This doctor had to ask strangers for donations of new masks. I found 2 boxes on my doorstep this morning," she tweeted. "Thank you to whoever you are." And this is what New York City officials say they will need by early April. 3 million N95 respirator masks, 50 million surgical masks, and 25 million surgical gowns and gloves. Most of these products are made in China and in short supply on the global market. So New York's mayor has gone so far as to say the U.S. military is the last resort.
If we expect those goods that are produced that we need for our hospitals to get there in time, there's only one organization that can guarantee that, and that is the United States military. When will President Trump give the order? That is my question. When will he give the order?
If the supply problem isn't fixed soon, this stark warning.
We might get into that terrible ethical problem that the Italians are unfortunately finding themselves in, which is who will live and who will die, who will get the ventilator, who will be taken off the ventilator, and who will be given it instead.
For New York, a need for medical supplies, and soon. Gabriel Elizondo, Al Jazeera, New York.